Hi, I'm Ann Anderson-Berry, the Medical Director of the Nebraska Perinatal Quality Improvement Collaborative and the Chief of Neonatology at Nebraska Medicine, UNMC, and Children's Hospital and Medical Center here in Omaha, Nebraska. It is my honor to serve on the Medical Advisory Board for Count the Kicks. Count the Kicks empowers women to learn how their babies move in utero and prevent still death. This is a profound opportunity to decrease stillbirths across the country. Thanks, Count the Kicks, for everything you do.
Hi, I'm Dr. Ruth Fretz. I've been studying the prevention of stillbirth for some time, and given this strange time that we live in, it's all the more important for mothers to be empowered. You have to know when to call, and keeping track of your baby's movement is a simple thing you can do, because a healthy baby is an active baby. And if you're worried, you should call. We're here to listen.
Hello, my name is Nancy Travis. I'm the Director of Women and Neonatal Services at Lee Health, Cape Coral Hospital, and the Florida A1 Section Chair. I learned about Count the Kicks several years ago when I was at an A1 conference. I brought the information back and my team readily put it into use. A little while after that, we had a mom that noticed her baby's kicks were not what they should be. She spoke up. She came to the hospital. We did an emergency C-section as her baby was in distress and ended up with a healthy baby. We are very thankful for Count the Kicks. It is a simple, easy application that can be used by any new mom. I'm also very excited to be sharing this information with the state of Florida. We'll save more babies' lives together.
Hi, I'm Jen Callahan. As the Manager of Childbirth Education and Doula Services at MERCYONE Des Moines, I'm blessed that I can share my passion of teaching healthy birth outcomes, including Count the Kicks. Our never-ending mission is to teach expecting families about the importance of tracking fetal movement in the third trimester in all of our prenatal classes. My instructors take the time during class to discuss the organization, explain fetal movement, and show families how to download the Count the Kicks app. As a childbirth educator and doula, I want to make sure families learn and understand that babies will never run out of room at the end of a pregnancy, and paying attention to their baby's movements as to what is normal for them is so important. I love working together to continue to save our babies.
I have been involved with Count the Kicks probably from early on in its beginnings. When I was an executive director at the former Iowa Health Des Moines hospitals, I was the executive director of women's services. And part of my responsibilities, including the obstetrical units, I had the wonderful opportunity of meeting with some very wonderful women and their spouses, the founders of Count the Kicks, who came to us after experiencing a loss or stillbirth and wanted to present an in-service for our nursing staff and our support staff about their experience and how we helped them, how we could have done things better. And it was probably one of the most powerful and interesting in-services, totally presented from the heart. And it was presented by these wonderful women and their spouses, and was very, very moving. I remember it well because I received more compliments on that in-service and that educational session from our staff than any before. So I was involved from the early start. I am totally impressed and excited about the work that's been done, the outcomes, the data that supports the wonderful work, and I continue to be interested in this excellent initiative. I now reside outside of St. Paul. I moved here for an obstetrical position that I actually left about a year ago, and I'm now working in a different setting. I am in a clinic setting where I serve the underserved. So I serve women and men, but serve women from a very different perspective, one of health promotion and wellness, and many of whom, of course, are childbearing age. So we do a lot of work on education, healthy nutrition, exercise, etc., so that when they do have a child, that their likelihood of a positive outcome is greater. So the work with Count the Kicks has moved me in many ways. One of the areas that I was especially interested in relates to a personal experience. When many years ago I was a college student and my older sister experienced a stillbirth of a baby girl after many, many hours of hard labor. I happened to be babysitting for her toddler at the time, so while I wasn't closely involved, I was sitting on pins and needles wondering when that baby was going to be born, and was devastated when this baby did not survive. What I remember most about that whole experience was suddenly that whole situation became invisible. It wasn't talked about. It wasn't discussed. It wasn't mentioned. My sister didn't talk about it. There were tears. There was a service at the cemetery. But it was surreal because suddenly this never happened. And it haunted me. And I know it had to haunt my sister. And she's no longer living, but I fully believe that in her heart that was probably one of the most painful pieces of unfinished business that she took with her. And that stayed with me to this day, and that's an impetus to stay involved with Count the Kicks. I'm passionate about women's health. I'm passionate about pregnancy and healthy babies and healthy outcomes. So while I no longer directly work in that field, I am indeed very, very committed to improving outcomes and helping in any way I can. I ask for your support. I'm happy to be part of. Any dollar amount helps this wonderful initiative. It's important for you, it's important for our communities and the broader country at large. I look forward to continued service. I really value very much the efforts, the grassroots initiative. I'm so impressed with. They started because they all shared a common experience in some way. And I follow them to this day, and many I am friends with on Facebook, so I get to see their children grow. And I'm also a mother of 6 children myself, and know the depth of that childbearing experience and the importance of positive outcomes. So with that, I thank you. I invite you to contribute in any way to spread the word. Dollars, of course, are always welcome, but I really, really appreciate your efforts, and thank you for taking the time to listen and hear some wonderful things about Count the Kicks. Thank you.